Internal Medicine in Transcript, led by students of Jinnah Sindh Medical University. Today, we are privileged enough to have Dr. Sarfaraz Hasni on board as a prestigious guest speaker. Dr. Sarfaraz Hasni is an expert in rheumatology with 30 years of medical and research experience. In 1993, he graduated from Sindh University. Following his fellowship, he joined the National Institute of Arthritis, Musculoskeletal, Skin Disease, and completed the NIH Duke Research Masters in Clinical Research Program, where he established a network of lupus-focused rheumatologists, nephrologists, and other medical specialists interested in clinical research. In addition, he is also an active clinician and faculty member of Rheumatology Fellowship Program, where he has worked on a number of initiatives. In 2020, he won a Research Initiative Award for his project, which mainly focused on establishing peer mentoring for minority lupus clinical research participants. I would also like to take a moment to introduce Asad Mehdi, the president of IMIG and a fourth-year medical student at JSMU. He and his team members have made it possible for us to have Dr. Sarfaraz Hasni join us today and lead this session.
Okay, thank you so much, Usman. So Dr. Hasni, first of all, welcome to you from the side of IMIG team. And we're so pleased to have you here. And the session is aimed to be very casual. First of all, in the first half of the session, I'll be discussing some stories with, I would like Dr. Hasni to share his stories so that we all can connect with him. And then in the later part of the session, that you guys will be allowed to ask your questions directly from Dr. Hasni, whatever concerns you have regarding wherever, regarding your future, if you need any clarity or something. Assalamu alaikum, Dr. Hasni.
Walaikum assalam. First of all, thank you so much, Asad and Bisma, for a very kind introduction, and thank you so much for asking me to join your sessions. I'm very excited and glad to be here. Obviously, SMC and JSMU has a very special place in my heart, and this is where all it started for me. Asad, is it the time, or I might have the wrong? Maybe just, do you want to wait a couple of minutes for people to just join, or because I see some people are still joining? Because I think we're a little ahead of, a couple of minutes ahead of our time, or no?
We'll wait a couple of minutes and surely you can start.
Maybe just like a 1 minute or so, because sometimes people have little trouble joining.
We actually asked the people to join in by 7:45 so that we can start by maximum.
I see.
But it's
I got it.
Fair idea.
Okay. All right. So then maybe we should go ahead, and again, thank you, and nice to see all of you here. How do you want to do it? Just, do you have any?
I would love to hear from you, your journey at SMC, your journey after SMC. I would love if you can start with your time at SMC and onwards. Dr. Hasni, can you hear me?
Sure. Okay. So so my journey at SMC, of course, pretty maybe similar to a lot of other people. Just after my college, I was at the DJ Science College. I graduated from there, and then I got admission at SMC. When I visited this year back in February, it of course is much different than how it used to be, and a lot of new things that you see. The lectures are all much better than what it was before. Yeah, so, but I mean, I think the structure was similar. We had the 5 years of training. The starting third, fourth, and fifth year, we would be doing clinical rotations in Jinnah Hospital, and we used to have an open. It didn't have so much walls, and we would just go and walk. So now I think there's a lot of walls and very high walls and things like that were not there. So that's
once you graduated from there, then how was the journey like for you after you graduated and onwards?
So I think somebody also asked. So I did my first step exam while I was in medical college. So between my fourth year and fifth year, I did that. And after that, as soon as I finished it, then during house job, the first few months of house job, I did the second part there. Okay, and then right thereafter, I did not complete my house job. I left because of some family reasons. Some of my family was already in US, and then rest of them were planning to go. So then I just went to US right after that, and then the new struggle starts, right? So when went to the US, of course, I've never been to US before. In fact, I'll tell you, which you guys will find something very funny, that up until that time, I actually have never been out of Pakistan. So the
Oh,
first time I ever
you
left
went out of Pakistan was actually.
or was going to
So
US.
how was the cultural shock back then, and how things are like? How was it going from JPMC? Like, were you did started your house job over here? You saw the work ethic over here, and then you went forward over there, and then you saw. I think that's a whole different world. So what's the difference? Like how it's different there in the States compared to back at JPMC?
Yeah. So I mean, culturally, of course, there's totally two different cultures. So there's 100% differences, and we didn't have as much social media, but we had a good idea because uh, how things were. Of course, I had some family there, so I had some idea because of that. In terms of work, finding residency is challenging. It was challenging then, and of course, it's much, much more challenging now. Um, but that was the time when a lot of people from Pakistan were going to US. Like around 1990, that's when the big flux of people started to go because they made some changes in residency hours, and how so because of that, there was a sudden increase in number of residence spot that opened up. So there was a mismatch in terms of how many US graduates were graduating versus how many residency spots were, and there was some due to some changes in the laws of United States, and because of that, there was a huge demand.
Yeah.
So it was relatively easy. At least a lot of people from Pakistan, like 2 or 3 years senior to me, they were just going, and so they were establishing there. So you had some sort of a network when you go there. But it was still difficult back then. But uh, starting residency was totally different experience. There's just like um, one thing in US, the residency program is very structured. So from even before day one, before you start, there was orientation. There was like very set schedule, how things are going to work, what you have to do, what you cannot do. Then rules and regulations are like totally different. How you follow different protocols. Things were very, so one thing which was very striking to me, that things are very well structured, that every day what you're supposed to do, what protocols you have to follow, how to write the orders, and also the supervision from your seniors, from R2, R3, and even from the attendings was huge because
Very different.
when you're doing house job, then a lot of time you're just kind of left on your own. But over here is just extremely structured. Yeah.
So, is there any particular reason you chose IM back? You did your residency in internal medicine,
Yeah.
right?
Yeah.
So what was there any particular interest you had in internal medicine? And what drove you to choose internal medicine as a residency?
So, I mean, I think one thing is that it I think a lot of foreign graduates do gravitate towards internal medicine because
Okay.
relatively easy field to get in, I would say. And second is that it I was not so much into surgery myself, so
Okay.
that was one of the things. And then I wanted to do something in immunology. That is, even from while I was in medical school, immunology was very interesting to me. So it was one of the few reasons, but I think it wasn't, now I think we have so much information and we sit down and think about things. Back then it was just, just kind of go with the flow, like everybody was doing this and you just somehow fell into that path. So I think you guys are, when I talk to some of you, I see that you're very well aware of what is going
What
on in
things
the
are
world,
forward?
and also making these very informed decisions. I think back then we didn't have as much information, and you make informed decisions but didn't have a whole lot of thought behind it. It's just okay, everyone is doing internal medicine. It seems like the way to go, and
To
I,
the way forward.
that's how probably I went. Yep.
Okay, so like you mentioned that you like started your residency over there, and how does things work? Like most of us, even if we know in this age of information, even if we know something, so that is what we know, that how to, like, the ways to get into residency in the US. But what it is like once you are in the residency, and how do you like steer forward from there? Like what are the particulars?
I mean, so one part of the journey is getting the residency, right? That's a huge
Yeah.
struggle. But once you get in, then moving forward, I think day to day, it's very difficult. I mean, at least the first year was extremely difficult. And now things are a little bit better because now they have further restrictions in terms of duty hours, and after 24 hours, you have to get so much rest. Back then, it wasn't like that. So it was definitely difficult, and but like I said, there is a lot of structure build up in the system. So you have people who will guide you. Always have somebody you can ask things, and I mean, now you have computers, so you can much more easily use a lot of things with your um, cell phone and even the laptops. But back then we had computers, of course. It's not like ancient times that there was no computers. There were computers, and we were using them. But it's a
Wasn't that
lot of
accessible?
yeah. So I mean, I don't know if I can give you an exact what is a day to day like.
Mhm.
It's pretty similar to how would you say the rounds. You just get up in the morning, you go and
Mhm.
see which patients are assigned to you. You round on them first, and then after that, there is usually morning reports to do the morning report, and after that, you will round with your attendings, and then finish up your work. If you are on call, you stay there. If you're not on call, then study and then go back next day. um, and the first year is usually extremely tough. Second year, you
What it
get a
is
little
for?
bit of time. But there is always expectations to do some research. So that's you have, in addition to
Expected to do
those work.
research during your residency even.
Absolutely.
Like, is it
Absolutely.
for like all programs?
Yeah, for most of the program, they would like you to do at least some kind of scholarly activity, they
Research
would
work.
say. If you are in community-based programs, then it's not as much emphasis. But if you do it, it definitely makes you stand out. If you don't do it, do some kind of activity, they're still okay. But if you are in a university-based program, then definitely you have to do some research.
So, like reflecting back from where you are right now, and then if you look back, so how do you think, like, or how, like, if I put it straight ahead, what would be some advice you'll give people who are like me, who are still medical students, who are still in med school, that what are the particular things they should focus in their med school so that they become better physicians later on?
I think the first thing which will always help you, and of course that goes without saying, is to make sure that you have a very solid knowledge base. I think people who have good knowledge base will always be successful. So, as a medical school, as a medical student, the number one thing is to make sure that you learn your your pathology, physiology, pharmacology, whatever you're learning. Make sure that you learn it in depth and understand what you're learning. And of course, having clinical experience definitely helps. So having a good knowledge base, that is the must, number one thing. Then the other things that you can focus on, getting experience with research, getting some of the skills about how to do the doing something such as doing research, that would definitely also help. But the most important thing is to make sure that you have a good knowledge base.
Okay. So talking about research, there's this culture, especially in medical schools these days, that everybody, if I say it the right way, that publishing for the sake of publishing, like not publishing something substantial, maybe something that takes science forward, that takes medicine forward, and there's this like, what do I call it? This is this they're wrestling with the fact that they just get published, they get their name. So what's your thing on it? Does it matter that you publish something substantial, or any publishing is just like good enough to get across your residency program or your being as a physician forward?
Yeah, I mean, so that so this is something that which is very I think I would like to talk to all of you about this. So one thing is that if your goal in your life is to get into residency and get into a good training program, which of course our goal is getting any publication is better than having no publication, right? So at the minimum level, anything is better than nothing. But then if you are a little bit more serious about research, then just like anything else in life, it's a different set of skills. It's not, you cannot just do it on the side. So you need to acquire those skills. And if you're doing research, then trying to understand that why you're doing research, what is there a question that you're trying to answer through research, and having those skills to answer that question, and then publishing it where it matters to publish, not just publishing in throwaway journal, just to have some just to having some publication under your name in your CV. So I think it's important that you have to have a better understanding about what you're doing and why you're doing it, and then making those decisions. But at the same time, at least I know it's difficult to do research, and if you are not in a culture where research is easy to do, then doing it's swimming against the tide is very difficult. So having anything is better than nothing.
I see. So being at the research end of medicine, what do you think are like maybe just 5 or any number of qualities that you think must be present in someone? Like, how do I determine if I am made for research, or like they must be present there in someone who thinks they want to pursue a career which is research oriented? 5 qualities for anyone to be a researcher.
I mean, the number one quality is that that you have to have an inquisitive mind. So when you look at something, you have to kind of go beyond what is obvious and try to say, how they say, there's this famous way of root cause analysis, but maybe we can use the same analogy of the 5 whys, that whenever you see something, you ask why, the first why, and then the second why, and then so that's how you sort of build your brain in terms of trying to think about things a little bit more deeply. For example, you are in the clinic and you see that somebody has that you're seeing patients who are 10 years old, and all of them are coming with a right ulnar fracture, for example. And then in a day, you see 10 of those patients, and you say, okay, why is that happening? Then maybe there is a playground that they were all playing at. Then why they were there? So maybe there was a broken swing. Why there was a broken swing? Because the maintenance person didn't. Why there was the maintenance? So that you just have the 5 why. So you have the 5 why. So anytime you see something, think about answering it in 5 questions. Inquisitive mind is very important. The other thing is important is being is having perseverance is very important, that you have to stick with things, because as you know, from the outside, when you see a publication, you say, oh, this person has published, but to get to that publication, what kind of work that goes behind it, how many times you'd like fail 100 times, then you succeed 1 time. So you see one success, but you don't see the 100 time of unsuccessful attempts that has led to that point. So having that sort of mindset that you can stick with it, that's, I mean, in anything in life, resilience, as you probably know, that this Harvard longitudinal study, which is following people for last 74 years, they found that the number one measure of success is resilience. That how much you can, like when you get down, how much you have it in you that you can get up and get going again. So research is very important because things don't work. Even if you're doing wet lab research, like for example, on animal models or cell cultures, a lot of times you plan and things don't work. Clinical research, which I do most of the time, also the same thing. You plan, you do these things. Sometimes things work, sometimes things don't work. But you have to have resilience.
Okay, so there's this one thing that like you are constantly involved with that Apna YPC, Apna Merit Healthcare Research Program. So would we like to introduce us to what it is about, and so that I can later on share it with the audience, that the link for it and how to register for it. So what that thing is about. I think they're like weekly Zoom meetings, if I'm not wrong.
Yeah, every other week, every 2 weeks.
Okay.
So APNA, as most of you probably know, is the Association of Pakistani Physicians in North America, or APNA. And they have a subcommittee, which is acronym is MERIT, which is Medical Education, Research, and Technology. And basically, the subcommittee, I'm part of that subcommittee. And what they have envisioned about 2 or 3 years ago is to trying to establish a research network, research sort of infrastructure in Pakistan. And as part of that, they started having these webinars where initially they were bringing people, mostly of Pakistani origin, in North America, who are established researchers, to come and talk about their research experience and how that research experience can benefit others can learn from it. And now this part, what we are doing is that we are going towards to all the various institutes in Pakistan, academic institutes, and then now pharmaceuticals and other like clinical research organizations, that what are they doing in the research space, and trying to bring all that information together and see if we can establish networks where we can have flow of transfer of technology, as well as how we can help in terms of building a research infrastructure. In addition to that, the new thing that they have done is that they have established they've compiled all the resources from various research resources that are available for free for anyone who is interested in doing research, and you can join those WhatsApp groups, and they have posted all of that information. You can go and use those. All the webinars that Apna Merit does are available on their YouTube channel. So if somebody is interested, they can go back and learn. So those are 2 resources that are also available at your disposal.
So, okay. I remember when I spoke to you back then, when I met you a couple of years ago. So I was talking to you about something, and then you mentioned that the fact that you are a director at NIS, uh, and you're like the fact that you are there is like the chances of being in that place where you are right now is like very narrow. And you told me that there's like you don't have many people around in similar positions who are brown or who may be Muslim, something like that. So I hope I am correct about what I just said, but I'm quoting you back from Puri. So I just wanted to learn like a very personal question from me that what do you think that some qualities in you that uh, you think that were very important in order for you to get to that end and get to that position?
Yeah.
So when you look back, what are those few factors in your journey?
Yeah. So I think so one thing is that I don't think that I was so great that I'm here and nobody else can be there. That's not what I'm trying to communicate. That is not my intention. The reason is that the couple of reasons. So one is that when you do research, the most important thing is that you have to have a passion to do this. The second thing is that doing research can be very frustrating at times because things don't turn around that fast. You don't get any immediate instant gratification. You have to be in the game for the long run, and it can be frustrating. So it's not for everyone to do that. Second thing is that there is a financial factor to it too. So, for example, if where I am in my position right now, if I am in private practice, for example, or even in a pharmaceutical, there is a huge financial differential. So a lot of people don't choose to go into research because for obvious reasons, because uh, when you look at the two places, there's a huge difference there. Uh, but I think in personally, what I would say, there are like two types of qualities, as you probably know. One is the hardest skills that you have to have. The hardest skills are like what you have on your resume or your CV, your knowledge base, the scores in your test, your GPA, whatever degrees that you have. But then there is a set of soft skills, and I think in this day and age, soft skills are if are equally, if not more important than having those hard skills. And to be successful in life, I found out that in professional interactions and other ways, I found that having those soft skills are very important. And I think one of the things that helped me a lot is again having that resilience, and also able to sort of be there. I guess sometimes you just have to go above and beyond. And I think I always was. Wherever job I was doing, I was just went above and beyond. So that I think people who are in the leadership position did see that, and then they see that I was very committed, and I have the compassion and passion to do things. Maybe that, and then of course serendipity. Sometimes just being at a right place at the right time. So when I was at the NIH, I was doing the clinical research fellowship and doing the Duke master's program in clinical research. The person who was my immediate boss, as I was finishing. So it's like within 2 weeks, they offered me, and I took his position. And that just more so, I would say, was because of luck. Stars align in the right time at right place for you, and those type of things happen. But I think I would say that somebody famously said that chance and luck favor people who are prepared. So if you are well prepared and you have positioned yourself, then if there is an opportunity, then you are able to. But if you are not prepared, even if there is an opportunity there, you would not be able to capitalize that opportunity.
Okay. So one last thing from my end, then we'll move it to general audience. I would just want to hear from you that how is the work-life balance, and how do you actually, first personally, I would like you to define that. What is the work-life balance? How do you personally define work-life balance? And do we have that there during residency, or we don't have a good work-life balance at that end, and then we can get it later during our fellowship or something? So how does that thing work in the with?
So, so if I'll give you a disclaimer that I'm probably the worst person to answer that question,
Okay.
because I'm still trying to figure that out.
Okay.
But I think, getting aside, one important thing is that you have to make a conscious effort. You have to see what your priorities are, and in residency, definitely very difficult to do that. Especially when you have family, it's extremely difficult. In Pakistan, I think one good thing is that we have extended families, and not only extended families, we can have some hired help that is much more easier and reliable. But here, you're kind of on your own. Everything you have to do by yourself. There's nobody. You don't come home from residency and expect that food is prepared and somebody is gonna your clothes are washed and somebody has ironed them, and everything from cleaning the house, cleaning the bathroom, cooking, washing your clothes, everything you have to do on your own. So having work-life balance, it's extremely difficult. It's a tough time, and that's why if you're lucky enough to have some sort of support, then of course it helps. Even beyond residency, it's not like things automatically get super easy, because you go from one kind of struggle, then you enter a different kind of struggle. But you have to make conscious effort. You have to make sure that you carve out time, and a lot of time, we don't realize, but we tend to just spend time in things which may not be as necessary. So you have to consciously make an effort every day that this is my priority, this is where I will end my work, this is what I'm going to do. So bottom line is that you have to be extremely organized. If you are organized and your priority are set, then you can have work-life balance. Nobody is going to, tell you that, oh, please, you have worked at 5:01 p.m. Please go home. Your family is waiting. If you're there, you can work till 8, 9, 10, 11. But again, if you just have to set the priorities.
Okay. So I think Bisma, you are here right now. Bisma, can you hear me?
Yes, I'm here right now.
Okay,
Thank
so I'll
you.
hand over the oh, sure. Over to you, Bisma.
Okay. Thank you so much, Dr. Hasni and Asad, for your invaluable contribution to such an engaging and lively session. I kindly request all the participants to submit questions for Dr. Hasni either through the chat box or by raising their hands so we can unmute them.
I think there are a couple of questions in the chat I can see. And then people who are putting the questions in the chat, are you able to unmute yourself and okay, somebody has a up there, this one.
Okay, thanks.
Is Daniel?
Daniel, you can unmute yourself and ask the question.
Assalamualaikum.
Well,
Sir, I want to ask you, do we need to clear IELTS for steps?
no, I don't think so. I mean, things have changed a lot. I'm not as close to residency, obviously, I'm very far removed from that. But I think if you do the USMLE, they don't require you to do English proficiency unless you,
They're to do OET now. It's occupational English test. We have to go for OET before in order to match.
Yeah, I have heard about OET. So can you
Sorry,
guide me
We are
about
not.
there's
IELTS
a
is
lot
no
of
more a requirement.
background.
can you guide me about OET?
Daniel, you have
Occupational English test.
Sorry,
okay. OET is actually an occupational English test, Daniel, and more like it that you are usually not tested on your day-to-day English. It's more towards your jargon of like medicine-related
I
jargon
see.
and everything, and how to talk as a professional doctor. So it's an occupational English test. I hope I'm clear, Daniel.
Yeah, it is. Thanks.
That's most welcome.
I think Bisma, there are some questions in the chat.
Yes, there's a question from Mohammed Swaleh, and he wanted to ask you to talk about high burnout rates of US doctors.
Mohammed, are you able to unmute yourself or
Follow?
maybe not? So, yeah, I mean, it's a huge problem. I mean, it just people,
Yes,
you
I
know,
will.
there's so many demands on your work. Please, Mohammed,
Assalamualaikum.
go ahead. Wa alaikum salam.
Yes, please, Dr. Hasni was saying.
Yeah, so I'm saying that it's a huge problem, obviously, because the issue is that there are so many demands on your time. So, you know, when you're working, you have to see the patients, of course. In addition to seeing the patients, there's a lot of documentations that you have to do. In addition to documentations, there are like so many other things, you know, in terms of like dealing with insurance companies, and so many like levels of management. People are looking at your chart. Somebody is asking for this thing, somebody else. So it's just basically, you know, you only have, you know, they give an example of the pizza that, you know, you have so many pies. So if your pizza is like your 24 hours and you can cut it into so many times, and if you just keep cutting and cutting and cutting, there's something is going to happen. And then you have that burnout. But people are some of the people get, after being in medicine, they just get so burnt out that they start to going into different for example, they go to pharmaceuticals, or they go to other non-traditional type of jobs. They are you know, talking about mindfulness, they're talking about things that, you know, how do you take a break and make sure you take vacations. And then also the other thing is that in culture here, there's like so much competition built in, because there's if you don't do XYZ, there is always somebody else as competent or more competent than you waiting to take your job. So people have this inbuilt sort of insecurity that they have to keep working and working and working. And that's sort of, you know, how the society is built, which is sort of the capitalist model of society, that everything is just so super competitive. And if you are not performing at 110%, then there is always this built-in insecurity that, you know, as soon as you miss something, somebody else is able to take your job. So that may not be 100% true, but that's how everybody perceives the system. And then the other problem is that there is so much litigation also, that if you miss out on something and if you don't do, then you always have to worry about making sure that your documentation is right, you're not missing out anything. So those are some of the reasons for burnout. You know, the people are trying to work on this, but definitely a huge problem.
Thank you so much, Dr. Hasni. I have another question. So I've heard this thing about couples match. Do you know anything about it?
Yeah. So couples match is like, you know, you and your spouse, of course, you would like to be together. So then you apply to residency program and you say that you're in a couples match. It doesn't have any specific advantage, except that if one of you is exceptionally qualified and talented, then what I found, that's when it's very advantageous that they want one of the couple, and then because they want to specifically match you, they will make an extra effort for the other person to be matched. Or you're both equally competent and you're going to be matched anyways, and then they will consider, okay, so my husband or my wife is going to be there, so then the other person, then the programs will look at more favorably. It doesn't have like any specific, it's not like gives you any advantage on anybody else. So you have already at a level that you will be matched. But the only thing is that you're just telling them that, okay, if you are considering me and my spouse, then please, we will both like to be matched at the same place. I hope that's my answer.
Yeah, that makes sense. Thank you.
Dr. Hassan.
Yep.
Okay, I'm the student of 4th year. I'm with this. I want to ask you that if someone wants to pursue the research in the future, and I'm specifically asking about the USMLE. I want to ask that if I want to pursue the research in the USA and I don't want to give the USMLE, so there isn't any alternative pathway that I can pursue. Alternative of the USMLE, and I am just asking that if I complete my bachelor's from my university in Pakistan, then I go to the USA and apply for the master's program or any other fellowship program. Is there any possibility? If you can guide me.
Sure. So the non-traditional pathways, and I think I have some information on that. I can maybe share it after this with Asad and Bisma. They can share with the rest of you. So there are a number of non-traditional pathways. There are not as many opportunities available as compared to getting into residency program. But if you have not done USMLE, or if you don't want to do USMLE and get into non-traditional, then number of things that you can do. Like I said, it's limited opportunities. One thing that if you are thinking of maybe getting into doing some research, again, so doing research is acquiring a totally different set of skill sets. So it's just like, you're doing MBBS, you're going through 5 years of training, studying and then training. The same thing is that if you want to do research, you have to have something, an additional degree, or you have to have done some work in that field. Getting into research without an MD is very difficult, because people here who do that, they have spent decades, or not, at least 10-15 years of research, and they've made their name by working from a very low level to get to that point. So that is not an easy path. The other path is getting into like from kind of pharmaceuticals. Again, there are limited opportunities, and I know people who have done that, and they've been successful, but there was like, I can count them on my fingers how many of those are. Other non-traditional pathways, like sometimes you can do like quality assurance, quality control type of work. That they also need doctors for doing that sometimes. Other things I think I can think of non-traditional pathway is there are sometimes special fellowship programs, but those fellowship programs require two things. One is that you have done some special training in your home country. For example, I know somebody who got into a fellowship because they were at like an associate professor level in their country, but they still had to do the USMLE, and then they can like have a lateral entry without going through residency. I can provide you some more information. I think I have it written down somewhere, and I can share with the moderators, and they can share it with the rest of you.
Thank you so much.
Yeah. Sure.
I have some questions.
Or
Can you please unmute yourself?
Hello, can you hear me?
yes, can you?
Assalamu alaikum, sir. How are you?
I'm doing very well, thank you. How are you?
I'm good, alhamdulillah. Sir, I had a question regarding the type of research that is prioritized, or it could give us an edge while pursuing, the STEP pathway. Jaise, if we go for PLAB, right, तो clinical audit has a certain edge, जिसकी basis पे आपकी CV काफी strong हो जाती है. तो is there a certain type of research जो हमारे USMLE pathway को बेहतर कर देगी या हमें एक edge दे देगी?
Good, very good question. So I think the first thing I said is that getting any type of research is better than not having research. But if you want to show or come across as that you're interested in clinical research or you're interested in research, then one is that you have to have those skill sets, that you have to show them that you have done something extra. Second is that when we look at research here in US, we're looking at somebody who's interested in one specific topic and they're trying to understand or answer that question. A lot of time when I see the CV from people who are coming from Pakistan, they have done research, they have done like something which is related to cardiology, then something that is related to nephrology, something infectious disease. So when you look at the CV, it looks like that, you've done like a whole bunch of things, but there is no focus. The research, the number one thing that anybody looks at is that how focus. So, I mean, I can tell you where the place where I am, people have spent their life is just studying one protein. So their whole life, they're just looking at how this protein works, and so that's how, I think the importance in research that the knowledge base has to be horizontal, but the research effort has to be vertical. So you have to be
Sir, sorry to cut you off. I'm just asking that, is there I have heard a lot of time that the meta-analysis has a more weightage than the cross-section. If someone do more metas, then he would be considered more valuable than who done some cross-sections. Is it right, sir?
Okay, so let me clarify where you're coming from. So in terms of looking at a publication impact and the level of evidence, a level of evidence of meta-analysis is much, much higher than a level of evidence of one paper, obviously, because it's just synthesizing so many different papers and then you're looking at. But in terms of, saying that you are a good clinical researcher or you're doing much more research, that's not true. Because if, for example, if you've done 10 meta-analysis in 10 different topics, it means that you're good with meta-analysis, but it doesn't tell me that you're a good researcher. It tells me that you have the skill sets to do the meta-analysis, and that in itself is a good thing. But for example, if you've done 10 meta-analysis on the risk of high LDL associated with cardiovascular disease, it means that you want to answer this question about what is the risk of having a high LDL, what is the risk of having cardiovascular disease with a high LDL. And that tells me that you're serious about clinical research. So there are two different things. Doing 10 different meta-analysis means that you have a good skill set, that you can do meta-analysis, but it doesn't tell me that you are a good clinical researcher. It means that you have that skill set, you can do it.
Okay.
I think Arham, you have your question answered clearly. Arham, you are there with us.
There is one more question for you, Dr. Hasni. What are the most significant personal growth experiences you have encountered while pursuing your medical care in USA, and how have these experiences shaped your perspective on life and your approach towards medicine?
Very loaded question. Okay. I think personal experiences, the one thing, again, I will come back to the soft skills. I think this is very important to have those soft skills. So you want to make sure that you are a person that others would like to work with you. So you are an approachable person, and you're congenial, and you are somebody who is genuinely interested in others and genuinely interested in helping others. And when you do that, I think it's karma that when you do good, it always comes, the good comes back to you. So again, having soft skills, I think that helped me a lot in my life. I would say that, even in med school and even in residency, I was not at the 99th percentile. But I would say that I was at like 90th percentile. So, but when I see the people who are at the 99th percentile, when we were in med school, we thought that they will be the one who will be most successful. But I think, I found that the most successful people from med school, from residency, even later in life, are somewhere, they're not at the extreme top, you're not low, but you are at, but at the same time, the people who succeed are the ones who other people would like to work with them. Like they have this personality, they have communication skills, which is very important. Especially in US, extremely important to have good communication skills, your language skills, and how you talk. And I mean, now, of course, you guys know everything that happens here, probably sooner than we even know. But there are like cultural sensitivities, like what are the things that you can say, what are the things you cannot say, how you have to be dressed, how you smell, how you look. A lot of these things count a lot. How you carry yourself when you sit across somebody, how do you sit when you talk, if you're looking at them, because culturally, like for example, one thing, maybe when Asad was asking, now it comes to my mind. Like when I first came to US, one thing that was kind of drilled into our heads is that, seniors and elders and how you to be respectful and how, not to look at them or talk. But here it's totally opposite. You're supposed to, be upfront, and that culture of that respect that is kind of drilled into our heads is not here. It's like totally opposite of that. And for example, when you're talking to the opposite gender, we, like how we were raised, that you have to kind of lower your gaze, don't look at them. And here if you do that, then they feel that you're being disrespectful. So these are things which are like very small things. And then especially South Asians, we tend to not boast about ourselves, our achievement, and how good we are. And again, here, people, even if they've done it just a little bit, they just talk so much that they have achieved. And I think I would say that up until this time in my life, like, after being so many years, it's still a struggle with like talking about myself, that I've done this, or I achieved that. It is a constant struggle that we have to overcome. So these are things that you have to, consciously work. But then again, I think that certain things that we can certainly improve is that how you sit, how you walk, how you dress. Those are very important things. And those definitely help it. I interview a lot of people because for hiring them in junior positions or for fellowship interview. And when you are interviewing somebody, within like few minutes, you can tell a lot about their personality. It comes across because when they're talking to you, when they come and sit in front of you, when they shake hands with you. So those skills, you need to focus on that. That will make you successful in life by acquiring the skills, because all of you are in med school. So, they're definitely extremely intelligent to make it here. There is no doubt about it. So it's not that you have a low IQ or anything like that. You don't need to work on. But having the other skills, that is something you should focus on to be more successful in life.
Thank you so much for your reply. There is one more question from Daniel. Daniel, can you please unmute yourself?
Am I audible to you?
Yep.
Okay. Sir, another thing I want to ask about VSLO registration. Since SMC was previously registered in VSLO, but it is now registered in VSLO. So, what can we do regarding our hands-on after step 1? Because VSLO offer free of cost hands-on as well.
Sorry, I am very sorry, Daniel. I'm not able to understand what you're saying.
Sir, I'm talking about VSLO registration.
What registration?
VSLO.
So there's this portal, and that helps medical students
Oh,
get
that
elected.
thing.
VSLO, yeah.
So SMC was previously recognized with VSLO, but it is registered with VSLO, but it is not registered now. So is there any other alternative step we can do?
I sorry, this is something that I would not be able to answer because, like I said, I'm like so out of touch with day-to-day residency type things. Maybe unless someone else on the line have an idea, or Asad or Bisma, if you know, I'm sorry, I would not.
Daniel,
I
we
have no.
line up a session later in mid-October. Daniel, we have a session lined up with RC in Internal Medicine RC in the US. We'll be speaking to him in mid-October. Then you can certainly ask him about it. He must have a better idea because he's involved in, like, he just recently married and everything, so he must have a better idea. You can certainly join in that session and ask this question. Okay, Daniel? I hope I'm clear.
Thanks.
Thank you so
Yeah.
much, Daniel.
Okay, I would like to move on to the next question. It's from Sunny Asani, and he says that Dr. Hasni, could you please tell us what are the expectations of US MDs from us when we are shadowing under them?
When you're shadowing under them, I think the expectation is that one is that, which is very important, is to make sure that you understand patient privacy. That what happens there stays there, and you don't go out and talk to other people, or even like post on your social media. Even with taking out the identifier, you still should not post anything or talk to anyone with what you have done or seen in the clinic, because that is something extremely serious, and that can get them in trouble and get you in trouble. So, and second thing is that when you're interacting while you're in shadowing, to make sure that you understand your boundaries, and whenever you are with the patient, make sure that they have a consent, that they allow you to be there. Third thing is to make sure that you follow whatever the infectious disease protocols that they have. For example, make sure the washing the hand is very important here. Making sure if they're a mask mandate, then you use the mask mandate. Also, the other expectations is that you are respectful of their time, but at the same time, they should be respectful of your time too, because your time is also important. So when you're there, you learn from them, but then you have questions or something, they should be available for them to answer your questions, and also to guide you and make it a meaningful experience. One thing that I will tell you, I've been hearing a lot, is that people here in US have started to sort of exploit the students, and they have like charging money, and the large amount of money that they're charging for giving US experience. And I found that some of them are not even giving a good experience. They have like 20-30 students with them, and they're asking them for money, and that. So try to stay away from that, because both your money and your time is extremely valuable. Because you probably know this, a lot of you, but the age that you're in, they say that that's sort of a deflection point. So when you are in like your mid-20s, the decisions that you make and the achievements that has a very long bearing on where you will end up in life. So don't think that you are just a student. You are not. Your time is very valuable, and this is the sort of the golden time of your life. So spend this time very wisely, and spend your resources, money. Even if you are from a background where you can afford a lot of money, still make sure that that is hard-earned money. It's hard-earned time. So whenever you make a choice, think about it. Where you spend your time, how you spend your time, how you spend your resources.
Thank you so much, Dr. Hasni, for your reply to this question. There is one more question from Fatma. She says that, sir, can you get residency fellowship in USA after doing FRCPS or some other specialty from Pakistan?
Sure, absolutely. In fact, if you have done a specialty in Pakistan, sometimes actually it is considered to be advantageous, especially if you have done, for example, if you, I mean, I know a number of people who have done this and they found that is to their advantage. But if it's like a lot of years have passed, then that becomes a little bit difficult. But for example, if you've done MBBS, you've done house job, and then you've done FRCPS in 2 or 3, 4 years from there, and in the meantime you apply, then it could be a huge advantage.
Great. Thank you so much, Dr. Hasni. I think we actually are very, very thankful to you for this precious time that is like that you gave to us and for answering our very basic questions. And it was actually a pleasure having you with us. And I think there are a lot of thank you messages there in the chat box too. And we cannot just say it out that how obliged we are to have your time. And we found you very humble, and you were there to answer even the most basic questions. Thank you so very much. And it was amazing having you on the Zoom session. And you were great. You were absolutely great. Thank you so much.
So thank you for inviting me, and I'll be happy to come back anytime you would like me to come. And I think what I'll do is that I'll share some resources with you that you can share with the rest of the team. And if anyone is
I would love to
interested
do
in
that.
research, anyone is interested in research, I don't think that I can take everybody as my mentee, but at least I can guide them. Because obviously, I mean, I have limited time and resources also, but I can definitely point them to the right direction and give them resources. Thank you.
Thank you so much. I'll share the resource. Everyone, you can reach out to IMIG Instagram handle, and we will hand over you the resources that Dr. Hasni will be sharing with us. Thank you so much, everyone, for being here. Lupus.
Thank you. Lupus.